Hello and thank you for choosing St. Luke's. I'm Kristen Armstrong, and as a competitive world-class athlete and a regular patient of St. Luke's health system, I know what to expect when I need to take care of my health. But going to the hospital can be a bit overwhelming. Whether you are receiving care in one of St. Luke's physician offices, clinics, or regional hospitals, you and your family can expect to be treated with respect and compassion. St. Luke's consistently demonstrates their core values of integrity, accountability, and excellence in your healthcare needs. Your comfort and access to quality care is of great importance to the St. Luke's staff. During your stay, physicians, nurses, and their support teams are committed to providing the skills and services necessary to giving you excellent patient family-centered care. Thank you for taking a few moments to view this orientation video. We hope it will answer your most immediate questions and concerns as you prepare for your hospital stay.
Hi, my name is Anastasia, and I'm part of the care team here at St. Luke's. I'm going to talk about what to expect from our staff and how you can become an active member of your care team. I want to point out a few things to help make your stay the best experience possible. Your nurse and nursing staff will go over everything in more detail, so don't worry if you have more questions after watching this video. Your room has a few small storage areas for essential personal items. Space is limited, so please give any valuables or non-essential items to a family member or a friend who can take home anything you do not need. We recommend that you place your eyeglasses, dentures, cell phone, or hearing aids in a visible area and label them. Please make sure your nurse is aware of any valuables you would like to place in the hospital safe, because we cannot accept responsibility for any items kept in your room. The call button is located on the remote and on the side of the bed. Use the nurse call button to call for assistance whenever you feel that you need help. The bedside remote includes controls for the lights and television in your room. In addition, you can control your bed's head and foot position by using the buttons on the side rail. For your safety, 2 side rails will be kept up while you are in bed.
So today we brought you Asian stir fry.
Your physician may prescribe a diet for you based on your condition, or a care team representative will discuss your menu options and review any restrictions and allergies with you. Educating yourself about your care is one of the most important ways you can participate in your own recovery. The whiteboard in your room is updated each nursing shift with information about your care team and your daily plan. This may include any tests for conditions we are monitoring that day and your own goals for your care. Your safety is our highest priority. When you are getting in and out of bed, it's easy to slip and fall. The risk of falling is real for all patients. Some factors that increase the risk of falling in a hospital include medications, an unfamiliar environment, interruption in sleep patterns, fatigue, equipment in the room, and surgical or procedural sedation. Press the nurse call button to activate the monitor at the central desk if you need assistance, or if you have been instructed to call before getting out of bed. The monitor will notify your nurse, and they or another member of their team will come to your assistance as quickly as possible. You will also be asked frequently about minimizing and controlling your level of pain.
I'm going to show you a chart here.
We use a 0 to 10 pain scale to rate pain. Often following a procedure with chronic pain issues, it may not be possible to have a pain level of 0. Your care team will be diligent in helping you achieve a manageable pain level or baseline level for your condition. You can help us reach your pain level goal by telling us exactly when and where you feel pain, and also if the medication is or is not working. You may be taking medications you already know about, and others that are new to you. We will talk to you about all of your medications, teach you about common side effects you may experience, and help answer questions you may have. You may also be given a reference tool for your convenience called the Medication Teaching Guide. Remember, if you are given a medication, you have the right and responsibility to ask what you are being given and the purpose for receiving the medication. It is our responsibility to use 2 identifiers to correctly verify the right patient. All staff should check your first and last name, date of birth, or medical record number on your wristband each time they give you medication, draw blood, or perform a procedure. Please ask them to check and make sure they have the correct patient.
Hello?
All care team members are expected to clean their hands before providing you care. If you are unsure this has taken place, please speak up.
Hey, Mom. Hey.
We also ask that family members and visitors clean their hands with soap and water or use hand sanitizer often to stop the spread of germs while in the hospital. During your hospitalization, you may be connected to monitors, IV pumps, or other devices. You may hear beeping and other alerts from the equipment in your room and in the hall. These sounds are part of their normal operation, so you don't need to worry. But please ask if you want us to explain any of them to you. If the noise around the room becomes too loud or disruptive, please let a member of our staff know. We will do everything we can to resolve the issue. Our clinical staff will be visiting frequently throughout their shift to provide for your safety, comfort, and any personal needs. We call this rounding. If you require assistance to go to the bathroom, please take advantage of this one-on-one time with staff, as this time is dedicated specifically to your needs. Also, to ensure consistency in your care, we will provide a bedside shift report when your care changes from one nurse to another. Together, the two nurses will speak with you and your family at your bedside. Be sure to speak up about your plan of care and participate in this review of your treatment goals, specifically related to any new tests or changes in your condition. To create a healing environment, many people participate together to provide your health care.
Hey, I'm Dr. Nellie.
Although you may have a regular physician, other providers may be assigned to your care. We will always introduce ourselves. If someone you do not recognize enters your room, please ask to see their badge. Individuals who enter your room may include various therapists, lab technicians, case managers, food service, and cleaning staff. We promise to work together as a team, communicating with each other about your preferences and care needs. There are many services the hospital offers, and your nursing staff can review these with you at any time to help you identify the right services for your needs. From day one of your admission, our goal is to get you back to your highest level of functional health. Once your doctor writes discharge orders and they have been received by your nurse, the care team will begin work preparing for your discharge. This may take some time. There are many steps involved in coordinating your transition home or to another facility. We appreciate your patience as we make the necessary preparations for your departure. As a member of the care team here at St. Luke's, I personally thank you for taking the time to watch this orientation video. Please know you are the key member to your care team, and we encourage you to be involved in your health care. Ask questions, tell us your concerns, hopes, and needs related to your care and treatment. With your assistance, we can work towards our mutual goal of giving you excellent care in a supportive environment. Thank you for choosing St. Luke's.